Caitlyn is a 33-year-old woman living in coastal Virginia. She was diagnosed with IH 2 years ago and has been on Xywav for about 18 months, and she is now thriving in her own way. However, her journey of understanding herself and her health started long before she was formally diagnosed with IH. Caitlyn was once a promising military paediatric resident with a bright future in developmental behavioural paediatrics. And she's excited to share how she came to embrace her IH brain and the life she now leads as a retired, unemployed veteran and cat mom. Let's welcome Caitlyn. All right, Caitlyn, it's so good to see you again. I love every conversation that I have with you. I'm particularly excited today because I think we've got some new topics that we can do a deep dive in. And dare I say it, they're not conversations that are typical or easy to have, and yet you're a really easy person to communicate with. So thanks for joining us today on Living With. So just for the benefit of our audience, I know we've done a part 1, this is a part 2, but can you just give us a really brief synopsis of your journey with IH?
Sure. Well, thank you for having me. I'm very excited to be here. And my brief synopsis is that I was a high achiever and went through like high school and college and was just going through life, high achieving, got into med school with the military paying for it, and thought that it was more tired, harder to study, that sort of thing was just part of like going through like maybe burnout after being a high achiever, and didn't think much of it, lower mood and whatnot. Into my pediatric residency is what really pushed me to seek more help, was the lower mood. But even once my mood improved, my therapist was like, no, I think this sleep is something different, and got me in with a sleep doc. And that was when it was like, oh, no, you just on clinical symptoms, like, I think you have like actually narcolepsy based on clinical symptoms. And lo and behold, it was IH. And that was almost 3 years ago now that I was diagnosed, but my symptoms probably started in my mid-20s, like sometime like second, third year of med school type of thing. And it was pretty progressive until I got on Xywav now about 2.5 years ago. And it's been a bit more stable. Like my symptoms have been a bit more stable since. And yeah, so that's where I'm at now.
So I know that as a pediatrician, I mean, you're in such a unique position as someone with
I never
lived experience.
finished my pediatric residency. I just want to clarify that. I ultimately was retired and I never finished, but
right. Okay. So I know that, but let's just say, is that because of your IH? How do you explain that?
So I ultimately left medicine, and I was really supported by the military, and I feel very grateful for that. And I'm not practicing medicine because of how IH affected my brain. Yes, I really struggled with task management, completing a lot of the roles that are expected of a doctor, like writing my notes, remembering my patients, remembering the encounters. You're going to see me up and lively because I'm on my stimulant, and talking wakes me up, like a lot of IH patients. But within my clinical duties, I couldn't remember the medical knowledge to treat appropriately. And so it really was not safe and good for me to continue medicine.
So while you were doing that training, you had obviously clinical responsibility to your pediatric patient population, but also you had an incredible access to parents. And I want to jump in here because I know that you're on an oxybate therapy. Again, lived experience, but I think what we want to do today is talk about how that has massive implications for young adults. Again, like that intersection between pediatrics, transitional care, and the parent caregiver.
Yeah, I think there is so much to be talked about. And I think that's the interface that I really get excited about, because I have a passion for the adult-child relationship and young adults having conversation with their parents about intimacy, about dating, about like safety, about financial success, about what success looks like, whether you have a sleep disorder or not, whether you're on oxybate therapy or not, how to ultimately like live on your own. I have like how to date safe in this like online dating world, like how to have someone over at your house safely when you have oxybate and stimulants, like that sort of thing. Like I've done all of that as an adult who has navigated and learned to be safe. And I am excited to share that. And I think learning how to talk about that confidently is something that I saw like a lot of parents have a lot of hesitation around when I was in those patient encounters. And so it's something I'm super passionate about.
Yeah. Let's start with success, because I think the moment your child, young adults, so I've got a bit of my parent hat on here as well, has a completely different like knockout life, that this isn't the same trajectory that you'd hope for or plan for, or the path indeed that they were on or that their siblings are on. And so you need this massive mind shift. And I think it's quite a difficult word, success, but tell me a little bit about why you're passionate about discussing this topic, especially with a diagnosis with IH.
We talked about my shift from going from like success, I guess, like conventional success as a physician, society, making money, to now unemployed in part one. But for me, I think even some of the language we use informs our thoughts and our biases and that sort of thing. And our kids pick up on it. So especially if you have a household where you're talking about success in one area with one kiddo who maybe doesn't have IH, and then you have a kiddo who does, your kids are going to pick up on that difference. And if we're talking about success, like, does success mean financial success, holding a career versus a job or a profession? What language are we using? Is success having the ability to live safely on our own? Is it the ability to have a degree? Like, what is your concept of success? What messaging are you putting out to your kids? And that comes down to the language we're using. Is having kids in a family what your idea of success looks like? And for me, success for me as someone with IH, like just getting up in the morning and like brushing my teeth once in the day, right, is sometimes like the most I can manage. But my personal version of success and like the meeting of the minds of like, okay, so what does your kiddo think of as success? Are they feeling pressures to meet your version of success? I certainly am not going to be a dog owner, for instance, even though I grew up with dogs, because they are just a little bit too much for my personal responsibility. But I own a cat and that makes me happy.
Yeah.
But I'm not going to be a parent personally of a child, because for me, I know that would be more than my personal amount of dedication I can give. So like, what does success and messaging look like? And what kind of messages are you sending to your kiddos? And so using language to consider how you talk about success.
Or
I think
even,
is important.
I mean, I'm always so challenged by everything you say. So even having a conversation saying, this is really hard, with your kid with a sleep disorder is, what messages do I give off about what success is? What is your idea of success? And how do we kind of keep in open communication about that? It's quite a hard start, but I'm sure once you start that conversation and make yourself vulnerable, because of course, as a parent, you're sort of scared that your kids are going to come up with something completely different, which they're entitled to, of course. But it is a conversation that we assume we're sort of having internally, but actually we're not taking the time and sitting down and saying, what messages am I giving off about success? I mean, we've started to have those, especially around academic success in our family, but there's so much more, like mental health. Can you live independently? Can you live how you want to live with two cats and driving, all the things?
I think that's an amazing point, Claire. And you hit the nail on the head with one of my favorite things is like a mantra I live by is you don't know what you don't know. And for me, that means you really can't know someone else's mind unless you verbalize it and use direct, transparent language, which means no sarcasm, no veiled language, but like true, honest, direct communication that is expressed verbally, because no one's a mind reader. And to really open up those conversations, have dialogues, because you're not going to know what they're thinking. They're not going to know what you're thinking unless you have those meeting of the mind conversations.
Yeah, that's so true. And I think also then digging into like the relational side of things, that's a whole nother ball game. And I think, one of the things I've really loved about talking with you over the last few years, Caitlyn, is your vulnerability and sort of giving us, sort of challenging parents to sort of say, we should be having conversations, yes, about success. And in some ways that's sort of easier than relationships. And then that added complication of being on an oxybate therapy potentially in college, and kind of first intimate encounters, and what is intimacy, and more importantly, what is safety at this point?
Absolutely. I really challenged myself to explore what is intimacy, what are resources for young adults, and how, like, what is that space in recent years, just really trying to understand that educational space. And it's quite frightening actually, because um, there's such an opportunity for parents, in my opinion, to reflect on like what are they modeling about intimacy? Are they what language are they using? What messages do they want to send? How are their kids learning about intimacy? Are they learning it from media? What kind of messages is media sending? Like podcasts, or what platforms on social media are out there? What is the current language? What is real language about intimacy versus colloquial language? And what does your kid know? And what would you want them to know? I think there's so much to explore, both within like intimacy with self, intimacy with others. And you're absolutely right. Like there is an added level of safety to consider when you have a young person who wants to be social, potentially wants to be social, potentially wants to have these novel, intimate experiences that also like has an added risk of having oxybate therapy and then like this amount of stimulants. And oh, by the way, those are both abused recreational drugs. I have had more than one person ask to try my oxybate. And that kind of blew my mind at first, because I was super straight laced. I was a non-drinker in college, and I was a go to bed early person. So I navigated that scene even without oxybate. But as an adult, staying safe on dating apps, figuring that out, and like now I have to think about, okay, do I invite someone into my space knowing that I have these medications? And how do we talk to our young adults about staying safe and keeping our medication safe and keeping us safe? Like those are the types of conversations that can be so powerful. And it's important to have with all young adults, but that added extra layer of safety can't just, in my opinion, just can't be ignored, because it at least bringing to light like the possibility of these conversations is really what I think we're trying to do here, right?
So as someone who's been on oxybate, wrestled with these like new situations where you're, potentially compromised or feel unsafe, what are the kind of like guidelines for conversations that you would advise us as parents to have with our adult children who have a sleep disorder and are on an oxybate therapy?
Right. I think for me, first and foremost, I would ask parents to examine self, examine what kind of relationship you want with your kiddo, like what kind, like that, identify the values you want to have so that you know going into the conversation, your approach, like understanding your own concept of these topics and where your own personal biases may lie, your own education on the topics. Understanding yourself will help guide where the conversation may go. And that way you can understand, like, okay, so what kind of opportunities do I want for my kiddo? Like, do I want this relationship with them to be one in which, if for whatever reason something happens and they trust someone, and then this person that your kid trusts, like, takes all of their stimulant or takes all their oxybate, like, does your kiddo feel safe coming to you based on this conversation you have? Or do they feel like you're going to punish them? Like, what kind of dynamic do you want with your kid? So I would first examine self, and I would empower you to really reflect on your own relationship with, if you co-parent, like, what kind of messages are you modeling about intimacy? Is it that if you're in a heterosexual parent situation, is it that only same sex talks about intimacy? Or is it something that, like, collectively it's becoming more comfortable to talk as a family openly about what intimacy is? What are you modeling about intimacy and relationships? Like, what kind of relationships do you want your kiddos to have ultimately? Do you want them to talk openly about intimacy? Offering, like, when you see media, just asking them, like, what do you know about intimacy? What do you think about relationships? The media has lots of different opportunities to be like, so that's not real. To wear a condom, right? Like, stuff like that. Like, if you see them watching something, see them, like, just jumping on opportunities to be like, so even though she hit him, like, that's also not okay, and you should never be touched like that either. Just like various opportunities in media, like, media presents so many opportunities to open the door to conversation. But if you're feeling uneasy about it, I really think the book Needy is a great place to start. It's Needy by Moira Glatzel. It's great for self-reflection and just to check where your own compass is, but also provide a language to start conversations.
That's so helpful.
So
Yeah, I think sometimes
that is where I
starting
think.
yeah, that's really helpful. I think sometimes jumping in and starting is like 90% of the challenge. And I think you made a couple of points earlier, like what are our priorities? And, as a single parent, I think, I want the kids to feel like they can come with anything, where there's a safe space and no judgment, but also that we need to have those conversations, particularly around safety, and especially with medication in sleep disorders, where, for girls or women, if you're on a certain medication that cancels out the oral contraceptive, make sure everybody knows. Just because we know it in our heads, are we actually reminding and communicating that with our kids? So what does that look like? It's not just a conversation around GHB, it's also like STDs and stuff like that. So it's a lot, and it's not one conversation, right? So I imagine what you're saying is creating a culture and an environment where these conversations happen over time, and in the context of where we find our young adults living, because it could be college, because you say very influenced by social media, or even peer, obviously peers, but it is quite difficult sometimes as a sort of older parent to like jump into a different, because I mean, it was so different. And that was without a sleep disorder. So any tips for parents like trying to navigate all of that? Social media, like I guess dating apps, being safe at home as a single woman on GHB. How's that been, Caitlyn?
So I love what you're saying.
I shouldn't say
Yeah.
I shouldn't say yeah. Okay,
Yeah,
we should
but
probably edit that.
oxybate,
Like
oxybate,
yeah.
absolutely. And it's helpful to remind everyone that like colloquially it is GHB.
Mm-hmm.
And
It is,
when though when I disclose to someone what medicine I'm on, I generally say oxybate and don't tell people anymore that it's GHB, because it
yeah.
reduces the likelihood that they may ask to try some. So like the way I talk about my medication, like when I inquire, like when I am dating or something like that, is on my mind. But I think something to note is that it's not just women who can get taken advantage of. Non-consent is a possibility to anyone, and I think it's important to note that you can get taken advantage of when you're subdued, regardless. And we want every young adult to feel like they can be safe and empowered to set their boundaries and know how to do so. Have the confidence and the comfort to articulate boundaries in an intimate state, in an intimate space. And I think that is one of my goals ultimately. But also just choosing when, like talking to your kiddo, like, okay, so when do you think that you could tell someone that you're on these medications? When do you disclose? And just asking them, because I think opening the door to conversations about just like, hey, so where are you at? What do you think? Tell me what you know. Where do you get your information? And just asking like, okay, so do you watch porn? Do you masturbate? Using real words, like normalizing the conversation is important. And then in terms of, you asked about how I stay safe living on my own. And for me, I currently am not dating. I'm not on apps, but when I used a pseudonym. I did not use my real name. I was very careful about what photos I put out there. I'm not on Snapchat. I'm very careful about what photos I put on social media. I'm aware of like where I put my location and that sort of thing. And then in terms of my home safety, instead of a do-it-yourself security system, I have a real like local central command security system that has
That's awesome.
like
That's awesome.
like an e-lock and smoke detectors and everything that's plugged into central command that will notify me if there's a break-in or a smoke detector, and notify authorities if I don't respond, which for someone on oxybate was really what I wanted.
Quick question there, Caitlin. Did you, when you set that up, so that's awesome, that's so much more sophisticated than I've got with the Ring doorbell, but did you have to let them know that listen, I'm doing this, but here's why. I'm on a treatment at night that's going to put me out or not? How does it
No.
work? The smoke alarm goes off and someone comes in at 2 a.m. How does that work?
Nope. So I researched a few different companies. There was one that needed me to have a second person to as a backup, and I did not want that. I didn't need that. I actually specifically did not want a second agent. I found a company that did not need that, and there's no rhyme or reason for why someone would want to go with them over a do-it-yourself. And just extra safety. But the way it works is that this company has the first of the when an alarm goes off, the central command will call me and ask for my passcode. And if I either don't give it, so I'm in duress or something like that and I can't give it, then the authorities are called. Or like for instance, if I'm asleep on oxybate, I don't answer, that sort of thing, the authorities are called. And no one's going to barge in. They're going to assess the situation, ring the doorbell, that sort of thing. And if I'm able to give my passcode, the alarm is called off and no authorities are notified.
It's awesome. That's so smart. And it makes me think of how difficult that is to sort of replicate in a college situation, having to have backup with the smoke alarms and just, the fire risk and stuff like that. I know we talked about some other life hacks, so I want to just segue a little moment into some of the things you found to like make life easier on the daily, especially around like health, personal hygiene. I thought you had some great comments there. Why don't we start with some life hacks you found as someone living with IH, particularly around women's health?
So in college, had I needed a backup, I would have told my floor or building like RA or whatnot, my resident advisor, that, hey, I am on a medication that like might make me miss a fire alarm overnight, and please make sure that if a fire alarm goes off, like I'm out the door. Please always look for me. I will check in with you if I get out there on my own, but like I would have set it up with my floor or building resident advisor.
Right.
But yeah, so in terms of
good
like
advice.
Life hacks, because I living on my own, like I have low energy, daytime sleepiness, and path of least resistance is how things will get done. Things that I've done to set myself up for success, dishwasher only cooking, cookware, dishware, everything goes in the dishwasher, otherwise it won't get washed. I have vacuums that I enjoy using. At first, I bought a stick vac that I did not like, and so I was like, nope, I will not use this. So I
Is it
made
possible
sure
to enjoy it? That's so funny.
I actually really like my vacuums. They're like nice. They're like the good ones that I like. So I like those. I actually brought some show and tell stuff. So the scrubbing bubbles, like gels that you can stick on things. I don't put these in my toilet. I put them in my shower, on the walls of my shower, because they decrease the need to wash my shower.
That's awesome.
I also have like the Clorox wand with the disposable, or the not disposable. Yeah, I think like disposable. You trash the circle. I put them by every toilet. Yeah, so I put that near every toilet, because whenever I see that the toilet needs to be cleaned, I will just pop one of those scrubby things, do the wand. Yeah. So I just have one by each toilet.
It's gotta work.
I auto ship my filters anything that needs to be changed on a scheduled basis. Like notification fatigue is real, and I won't do it unless it's on auto ship. It shows up when I need to do it, and I'll change it that way. For oral care, like I said, if I brush my teeth once, like it's great. So I have fluorinated mouthwash. I have one of like the generic water picks. I keep it in the shower. I have a manual toothbrush. I have an electric toothbrush. I have floss that I actually like. And then my retainer, like I'm not gonna brush it clean. So I have one of those like hypersonic shake clean things that when it gets really gross,
awesome.
I'll do that. So things
That'd
that
be
make
awesome.
it easier. And I think that's one thing that also could be like a meeting of the minds is like with your kiddo, like how do you experience your symptoms? Like where are your what are your like windows of tolerance for stuff and what's easier for you, what's harder for you? And because you perceive their symptoms and like my when I was living with my folks after I left medicine, like they perceived like words like laziness, clutter, and other, they had their lens that they saw my symptoms. But then I had my experience. And
Right.
so
Very different.
the manifestation of my symptoms looks one way. And I know why it looks that way. But then your experience of my symptoms and their manifestation looks one way to you. And
Yeah, it was
so,
through your own lens, isn't it? I
right.
mean, you know, it's always really sobering to me when I'm extremely, extremely tired and I can't like you know, I didn't water the plants or I didn't clean the bathroom. And it's nothing, so I don't have a sleep disorder. And in fact, this morning I even asked Matilda, like, I just don't know how you do it. Just don't know how I'm so tired just from other situation things going on in my life, but it's a real, for a moment at least, it's an intersection of like, how do you do it? And she then went into this huge list of hacks, even with studying, writing, doing extra projects. Like she's basically, when she's awake, she's multitasking at this high level because it's a skill set that she's had to learn to optimize time. But to your point about clutter, because that sort of drives me crazy in some ways, but I totally understand because it's just like the thing you never get to, you can't do it. So to find these life hacks, whether it's oral hygiene, cleaning every day is so important and so huge. And, you know, like, as you said right at the beginning, what is success? What is success? And I think to live independently in a way that's, you know, meaningful and you figured so many things out is success. And even without a sleep disorder, you know, parents have to like shelve their notion of it because you all have your own life and trajectory, and that's different to what mine looked like. So this is such a good reminder of respecting those differences, but also opening up conversations that, you know, are quite challenging potentially, but imperative.
Yeah. And for me, I think the opportunity to expand our idea of success as opposed to maybe like feeling like certainly like maybe feeling some loss around success or whatnot, totally valid, but also embracing the notion that there is a new definition of success, and like
Right.
really learning how to maybe embrace like the and celebrate the new idea around like success and how to move in that direction. Like that certainly the psychological flexibility of being able to like frame shift and genuinely appreciate and accept, like not like accept as in like roll over and like like acquiesce to it, but like really just like embrace this frame shift can allow for your kiddo to be like, oh, like this is something to aspire to, and maybe even just asking like, hey, like your symptoms, like do you have like the autonomic instability with the body odor and the night sweats, and do you
Right.
have any shame around that? Like do you like, are there aspects of what you experience, like the clutter or the life hacks that you do? Like are there any aspects of what you experience that make you nervous, make like how do you feel, like how do you navigate, like just open conversations around um how they experience things that, and then also not invalidating you and just letting them see you also, and modeling that vulnerability can be really powerful.
Yeah. Yeah, it makes me think that's so helpful. Makes me think how you also have to set time aside, or be willing to pivot, because sometimes I think, right, I've got 2 hours, I'm just going to flop, and the kids can come in and dump on me, and we can have these conversations, but actually, like, they're busy and they're doing stuff, like, or that's not my timeline. And they want those conversations, honestly, sometimes at 4 a.m. or 11 p.m. or unexpectedly driving to Costco or something. And, I think you just, as a parent, need to be available for those, and be a good listener and put all your own stuff aside, because it is, whether with or without a sleep disorder, and it is incredibly more complex with one, and medication and navigating adulthood. But even so, it's still, I think, putting your expectations aside and saying this is their life, and how basically our role, is to facilitate and encourage and support that towards their goals, independence and success. I hate that word, honestly, but I think these are really helpful conversations, Caitlyn, because if we can also talk about life hacks, as you've said, like there's resources with books and everything you might need in like a bathroom or a kitchen to just make it quick. Why, if you can do your bathroom in 7 minutes, why would you spend 60? Like, even that doesn't make any sense to me. So these are really helpful pointers.
No, I appreciate that. And you have such a willingness and understanding of Matilda, and this, that you've seen her so long, like work through life with her sleep disorder. You have such a profound understanding that navigating life with a chronic disorder is challenging, but it doesn't necessarily invalidate anyone else like yourself
Right.
going through life. And I love that. And I deeply appreciate how generous you are in being a parent. And I think that your willingness to have conversations and grow and really develop is so lovely. And I've really enjoyed like these conversations with you. And I think you get so excited and passionate, and it's really infectious. And I really can tell that you have great empathy, and it's just really lovely.
I think from a parent point of view, it's actually sometimes really uncomfortable and difficult, and it's very different from young kids or middle school. In fact, it's even more challenging, I think, because they are adults, but you're still a parent, and that doesn't go out the window just because they turned 18 or whatever. It's a very different world, to the one I navigated at their age. And I'm grateful for people like you, Caitlyn, that keep us on our toes and challenge us and give us resources to read and learn. So I'm sure there'll be a part 3 actually to this, because I know we haven't dug into accommodations, and you're an expert on that as well, and how we can support young adults with IH and sleep disorders, like just really thrive in these kind of huge transitional areas of their lives. So thank you for being vulnerable.
Likewise.
and sharing your personal experiences, and particularly from the parent side of it. I've already had conversations with my kids, and ask me in a few weeks, but so far so good.
Well, I'm really happy to hear that. And I so deeply appreciate your willingness to share. And yeah, vulnerability is hard. And I think you're absolutely right. I can't like the notions around intimacy and relationships have definitely evolved so much. And having those deep conversations around topics that can be even like can feel taboo and awkward, navigating what to talk about can be super challenging. So I applaud you for your willingness to go to some scary places.
Thank you. Yeah, thank you. It's a learning curve, I have to say. Let's have this conversation again in a few months, and I'll keep you posted how it's going. But thanks ever so much.
Of course.